Hello, everyone. Thank you for coming to my talk today. Today, my talk will be on using Twitter to characterize social distancing during COVID-19. I am Jiye Kwon, and I'm an MPH candidate from the Yale School of Public Health. So, social distancing has been the primary mitigation strategy to limit the spread of COVID-19. But it occurred to us, how can we actually capture and quantify social distancing in near real time? And then we realized that we can actually take advantage of the social media era we're in right now, where we already have 65 million users in US just in Twitter alone. So we use Twitter to actually define social distancing into facets, and we quantify the perception, implementation, and impact through captured tweets. So we use supply-based epidemiology approach to this study, wherein we set a time frame from January 23rd up to March 24th. We defined this period as early phase of the pandemic. We collected English US-based coronavirus tweets using the Twitter API, and then these tweets were defined into 6 different facets. These facets are 6 themes that were defined using top-down approach by carefully selecting keywords that belong to 6 themes of social distancing. And these facets were the following. It was purpose, implementation, adaptation, social disruption, positive and negative emotions. The purpose facet included people emphasizing why we have to actually practice social distancing, such as to flatten the curve. And then implementations were advisories from public health agencies, such as school cancellations or cancellations of events. And adaptations were how people adapted to this new normal with Zoom and then telemedicine. And then social disruption were how people's lives were affected with these advisories, such as travel restrictions, travel bans. And then positive and negative emotions, lastly, comprised of how people's emotions or emotional response of these people towards this social distancing. And we monitored the trend of these facets through proportion, and then this facets quality, if they capture the right context or not, were actually validated with diagrams, and this proportion changes were validated using chi-square test. As our result, we have this figure where it shows the change of the social distancing facets or the trends in US. In green box, we can see tweets or the proportions from January, and on the blue box, we can see tweets from March, and in the middle, we have the February. And we can see that the volume of social distancing tweets grew from 22% of January to 33% in March. And then in January, the predominant facet was negative emotion. Meanwhile, in March, the predominant facet was implementation. So now looking at it more closely into the facets, implementation, which predominated in March, actually peaked around March 23rd, around the same time when New York City was declared as the US epicenter. And then if we look at the negative emotion, which predominated in January, is no longer the predominant facet in March. It has actually shown a negative trend or like decreasing trend. Meanwhile, compared to the decreasing negative trend, we have positive emotions and purpose and adaptation that had increasing trend, especially peaking around third week of March, which coincided when public returned to work and school after their spring break. And then with these adaptations, such as using Zoom and telemedicine, this adaptation also coincided or was concordant with decrease in social disruption, wherein this may actually reflect people acclimating to this new normal we're in right now. Circling back to where we started, these social distancing efforts in US are unprecedented, and measurement or capturing is challenging. However, with this study, we have defined and captured facets of social distancing, which corresponds to events on the ground, and quantifying these facets of social distancing can actually be translated in different aspects and efforts of public health, such as understanding the public's practice and response to social distancing, And we can also evaluate the penetration of information and also evaluate the public health measures that the public health agencies are trying to implement. Once again, I would like to thank you all for listening, and I would like to acknowledge my co-authors, Connor Grady, Jose Maria Feliciano, and our PI, Dr. Sama Fode. Thank you very much.